If you think levothyroxine is the only treatment for hyperthyroidism, and if you're frustrated, you have hypothyroidism and you're frustrated because you're on levothyroxine, but you don't feel any better, this episode is for you. Today, I'm bringing you 3 ways that you can treat hypothyroidism naturally.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
Welcome back to the She's Healthy podcast. If this is your first time here, I'm Lori Aikman. I am a nurse practitioner. I am the founder and CEO of Crown Executive Health, where we help highly ambitious women to step into the greatness, the fullness of who they are by optimizing their health, helping them to feel better than they thought possible through functional medicine and functional nutrition principles. On this podcast, I'm bringing you quick, actionable, messages that will help you to really transform your health. We try to keep these episodes short at 20 to 30 minutes. So I'm going to dive right in. Now, I do have to give you my medical disclaimer before I get started. I am a nurse practitioner, but this podcast is for informational purposes only. So just make sure that you are consulting with your practitioner, your doctor, your provider before you make any changes to your health plan, and take this information as, exactly as it is, informational purposes. So a lot of women, I don't know how many women have told me they're concerned about their thyroid, right? They're struggling with these hormonal issues. Even when I was back in general practice years ago now, I think it's my thyroid. I think there's a problem. Like, we know that the thyroid causes a lot of these symptoms. I think that's well known in the, common knowledge, I guess is the way to say it. But so many women come to me and they're on levothyroxine, but they're like, I just don't feel any better. And a lot of women come in, they want to be treated, right? They're hesitant on being on medications long term. They want to feel good, but they want to do it in a natural and holistic way as much as possible. And that really is possible. So this is actually the last episode in a series that we've been doing on hypothyroidism. So I would encourage you to go back and listen to the previous episodes where we talk about the testing you should get done if you have hypothyroidism, signs of hypothyroidism. If you think you have a thyroid issue, but you're not exactly sure, we talked about Hashimoto's. So today we're just talking specifically about natural treatment for hypothyroidism. Okay. So I want to tell you a quick story. I actually had the privilege of working with a friend of mine recently. She and I have been friends for, we were trying to decide. It's been like almost 20 years or so now, maybe more like 15. We've known each other for quite a while, in our early 20s, and we both are turning 40 this year. But I remember actually when she was diagnosed with hypothyroidism back in our 20s. So she's had hypothyroidism for 10 years or more now, and has been on levothyroxine. And just like I said in the beginning, just never really felt that anyone was able to explain why, things weren't working for her. And even though her dose has been stable on Synthroid, she just doesn't feel like she's living at her best. So what we did was some of the things we're going to talk about, today, as far as some lifestyle changes and then some supplement changes that we did that have really helped her to feel energized, to be sleeping better, have better, mood swings, things like that really were a problem for her. And we've helped her to lose weight. She had even been on semaglutide with another provider for about a year, and just, had hit a plateau, wasn't seeing the results, still having a lot of the symptoms. And there really was some simple changes that we made with her. First, looking at her blood work, looking at her labs, seeing where her thyroid function was at, and then doing some of these natural treatment things that we've talked about. And so she has broke her weight loss plateau. She's now losing weight with ease. She has more energy. Her mood is great, which is so important for her as she works full time and does have 2 small children. Is married and just wants to be living her best, right? Wants to be feeling her best. So if that's you, if you can relate to any of her story that I just described, make sure you stay tuned for this full episode. So number one thing that we can do for natural treatment for hypothyroidism is really, I call them just some lifestyle changes. And of course, I know you've been told you need to exercise and you need to diet, right? Which is like, how many of us have been told, oh, it's just your weight and you just need to lose weight and do those things? Well, let's talk about what we really need when we talk about natural treatment for hypothyroidism. So if you missed the prior episodes, again, I'm going to be referring to some of those. Go back and listen to those. But one of the things that I see a ton in the women that I work with because they are highly ambitious, working women. They're whether they're working or sometimes we have stay-at-home moms that are just, high achievers, they're athletes, things like that. We are often doing all the things, right? How many of you I podcast, I have my own practice. I'm a mom of three. My oldest is 3.5. We have a 3.5-year-old. My daughter's about to be 2. And then we have a 5-week-old, right? I can totally relate to doing all the things. And what happens is just that demand on our body is triggering our nervous system. It's triggering our cortisol, right? I know you've probably heard of cortisol and maybe been told, oh, you have high cortisol levels. That's your problem. But really, that does affect the thyroid. And what we find is that when women have been under demand like that for a period of time, a lot of times we can see that there's adrenal stress where the adrenal glands are not functioning in that normal pattern. They're not putting out what happens a lot of times is the cortisol levels. We should have a natural, I'm trying to get away from using my hands, but just for the purposes, I'm trying to think which way is best. You would be watching this. So you'd have you have a normal cortisol curve. You should wake up in the morning, you have a nice uptick of cortisol, and then like within the first hour of waking up, and then your cortisol should gradually decrease throughout the day. And what we commonly see in our patients, especially the ones that we're able to test, is that their cortisol levels are dysregulated. Maybe they have high cortisol when it should be low. They have low cortisol all the time, things like that. And what happens is that this is really the root cause that then downstream affects the thyroid. So one of the things that we can do, and this is one of the things that we did in that patient I talked about in the beginning, was really supporting the adrenal glands in decreasing stress. And there even is some targeted supplementation we can do for the adrenals that can help them to get back in a normal pattern. So that was one of the things that we did with that patient. And it is so key because some of us can develop hypothyroidism. If you developed hypothyroidism, at a certain time, maybe when there was a lot of stressors, right? What happens is when our adrenals are very taxed, our adrenals are very stressed, this affects our immune system. And as we talked about in a previous episode, one of the major causes of hypothyroidism, especially in the United States, is Hashimoto's or autoimmune thyroid disease. So when those adrenals are stressed, that's going to decrease the immune system, set us up for development of autoimmune diseases like Hashimoto's, which is the main type of hypothyroidism that we see. So that's one lifestyle we can change. Another thing we can do is to decrease inflammation in the body. So a lot of times this is going to look like diet. Diet can be is probably the most, I think we eat 3 times a day. So diet is probably the biggest contributor to inflammation that we see. If we are eating a standard American diet, meaning you're eating packaged stuff from the grocery store, you're going out to eat, you're not, again, cooking a ton at home from all organic sources, right? We can be getting a lot of inflammation in our body just from our diet alone. So there are some changes that we can make when it comes to diet. And this looks like not necessarily eating all organic, but I will tell you 2 major contributors to inflammation that come from the diet are 1, grains. So yes, wheat and gluten, that whole train. But 2, I'm somebody who has a lot of inflammation from grains. So that is things like soy, corn, oat can also contribute to inflammation in the body. Another one is dairy. Especially our our pasteurized dairy that we get from the store. For many women, this contributes a ton of inflammation. There's actually a lot of evidence if you're struggling with especially hormonal changes, PMS, things like that, where you're struggling with heavy periods, bad PMS, there's a ton of evidence if removing dairy alone can improve your hormonal symptoms. But what we see is that it does decrease inflammation in the body. Again, inflammation is going to trigger that immune system, and then could set us up for decreased thyroid function. That inflammation alone can downregulate the thyroid. Then the other two things we have, which are related to, again, that autoimmune development, is a leaky gut, treating leaky gut, and then also treating gut infections. So not to dive too much into this, we're actually going to get into our gut focus later this year. But leaky gut is a layman terms way to describe that the in our small intestine, where our body absorbs the nutrients from our food, meaning food particles or little tiny molecules, right, go from inside the small intestine actually, and they cross over and get into our bloodstream. What happens in leaky gut is those passageways that are there called zonula occludens, those actually increase in size, and bigger particles than should be allowed through, than normally go through, get into the bloodstream. And this again causes inflammation, can trigger the immune system, etc. So treating leaky gut, which is a lot of diet cleanup, removing those inflammatory foods from the diet, can make a huge difference for leaky gut. The other thing is treating actual gut infections can help with this. This is what I see most commonly when we actually do a functional gut test with patients and clients, is we see that they have bacterial overgrowth often, and often low normal bacteria levels. So we have that good and bad bacteria. The good bacteria, you have to think of, I had an instructor explain as if you had a castle, the good bacteria are like the knights that would be on the perimeter guarding the castle, right? So when you have less knights there on guard guarding the perimeter, the bad bacteria can get in. And those bad bacteria cause a ton of inflammation. Those bad bacteria can increase specific markers, specific inflammatory markers, that will really cause a lot of inflammation and then that infection in the gut, which can then downstream lead to, again, that hypothyroidism, specifically Hashimoto's thyroiditis and hypothyroidism. So those are some ways to lifestyle wise, treat hypothyroidism naturally. So again, cleaning up the diet as much as possible, decreasing stress as much as possible, and supporting your gut function as much as possible. And again, I'll get into more specifics of that on a later episode. Make sure you subscribe if you have not already. Number two, what we can do to treat thyroid function naturally is actually supplementing thyroid nutrients. So just a quick review, our brain makes TSH, which is often, if you've had your thyroid tested, they've tested TSH. So that's actually a hormone that's made in the brain. It travels down to the thyroid and tells the thyroid to make the active thyroid hormones, which are going to be T4 and T3. Those thyroid hormones, the way our body makes it is it uses quite a bit of vitamins. Some ones in particular are iodine, selenium, the amino acid tyrosine. Iron is also involved in that can be involved in that process, as well as those ones are probably the four large major players, especially iodine and selenium. But then also zinc, some of our B vitamins, and then vitamins A, D, E, and C are also involved in making the actual thyroid hormones. So if we do not have enough normal levels of those vitamins, we have those nutritional deficiencies, our thyroid can just have a hard time making those thyroid hormones. I will tell you, I see this a ton on the labs that I review for my patients, is we see evidence of iodine and selenium deficiency specifically. So how do you fix this? I will tell you, there are a ton of supplements on the market that are like thyroid support. And what you'll see is that they're going to have a lot of these different vitamins in it. I have been recommending lately for my patients and my clients just a really good multivitamin. I will tell you this is not sponsored. I'm just honestly tell you what I've been using with my patients and clients. I've been using the Complete Multi from Designs for Health. Designs for Health is a great really well regulated, physician regulated supplement company. And they have a really great multivitamin that I recommend for all of my patients and clients. So I'll actually put the link to a supplement distribution company called Fullscript in the comments or the description for this video or podcast. So if you'd like to order and try that multivitamin, you can just click on that link to do so. If you use that link, I want to say you save 10 to 15% off of the cost that you would find, is going to be same on Amazon, same on their website, anywhere. So that's, just something you guys can do. Easy, go in there, order you a good multivitamin. And then number 3, so the first 2 ones, again, we were talking about those lifestyle changes to decrease stress, decrease inflammation, help gut infection. Number 2 was supplementing those nutrients that specifically help with the production of thyroid hormones. And then number 3 is medication. So yes, levothyroxine is going to be synthetic thyroid replacement. So levothyroxine is T4 replacement. It's synthetic T4. Just a quick review. There is sometimes people don't T4 gets converted to T3, and T3 largely affects our cells, affects, actually the effect the thyroid has on, your metabolism and your energy and things of that nature. A lot of times is happening at the cellular level by T3, some of T4. But again, with levothyroxine, all we're replacing is T4. So sometimes people need a little bit of T3 to boost that up. So there is synthetic T3, which is liothyronine. You're going to see this as brand names are Tiracint or, oh gosh, I'm blanking on some of the others right now. But again, we have that T4 replacement, which is levothyroxine or Synthroid, and then the synthetic T3, which is going to be liothyronine or Tiracint. I'm quickly trying to look up some other brand names for you. But then there actually is natural thyroid replacement. So this is going to be thyroid hormone that is derived from pigs. So that is the animal. Sometimes you have I use a adrenal support that's derived from cows, particularly for thyroid. You're going to see it derived from pigs. And this is actually something you can get at the pharmacy. Your regular doctor can prescribe this. They just sometimes aren't. I remember as before I really was trained in this, I didn't feel comfortable prescribing this for my patients because I just didn't know how to dose it. So you may run into that with your, general practice or primary care doctor. But what this does is we're taking pig thyroid, and what it's allowing is that you're actually getting T4 and T3. So you're able to replace both those hormones. And again, it's not a synthetic formula. It's coming from a pig. So I guess if you would be somebody who's vegan and is against any animal product use, you might not want to use that. But it is a natural option out there. The brand names for that are Armor Thyroid, Nature Thyroid, and NP Thyroid. Quickly, I was going to try to find if there's any other names for T3, but I can't find it quick enough. So I hope this was really helpful for you. Again, those were 3 just major things that you can do to treat your hypothyroidism naturally. Again, those lifestyle changes we talked about, supplementing nutrients. Again, I will put the link for that multivitamin that I use in my patients, or you can also find supplements from companies that typically they're going to be like a thyroid specific supplement. So if you look up like a natural thyroid support, natural thyroid supplement, you're going to see it's going to be like a combination vitamin that again has a lot of those things we talked about, the selenium, iodine, tyrosine, things of that nature. And then number 3, we can use natural medication that again is just derived from pig. So it is pig thyroid gland that is going to give you a combination of T3 and T4 replacement. So, what I want to invite you to is if you've been listening to our podcast and you're going, okay, this all sounds great, but how do I actually get started? Like, what would I actually, how do I even know? Maybe you don't have a diagnosis, but you have a lot of these symptoms and you're wondering what's even the first step to get started to get help. What I want to offer you is we're doing right now for the month of July, we're going to do functional health assessments. Again, this will be a link in the show notes or in the comments if you're watching on YouTube. But this is going to be an appointment that you can book with our team where we are going to have you fill out a questionnaire. And this is a smaller version of the questionnaire we start with all of our patients. So we have them fill out this really thorough questionnaire, kind of grading their symptoms. And it really helps us to narrow in on potential root causes of the symptoms that you're having. It can be thyroid, it can be adrenals, it can be pituitary gland, it can be sex hormone. And this questionnaire helps us to really, again, evaluate, okay, what is potentially your root cause without necessarily having to dive in and get blood testing or things of that nature done. So I'm going to invite you, if you've been watching, you've been listening, go ahead and click on that link and book a functional health assessment. You're going to be asked to fill out that questionnaire at the time of your booking. And then again, we're going to take time and review that with you and help you see what might be going on in your body, and then what the best next step would be for you to take based on what we find through that audit. So this is super, super valuable. Literally, so if you do consultations with functional medicine providers, functional health providers, this is literally hundreds of dollars value that we're offering to you for free, again, for this month. So I invite you to book that ASAP. And I ask that sometimes I have people book these calls and don't show up. Please don't book unless you're serious about actually, meeting with us. We value your time. We just ask that you value our time and only book that if you're really going to show up, be prepared, and allow us to help you, because that's what we do this for. That's what I do this podcast for, is to help women get answers so that they can feel better than they thought possible. I want you to have the energy, the vitality to go on and be that woman that you're called to be, that you envision for yourself, but maybe you just don't feel well enough to actually have the capacity to get there. So I want to help you get there. All right. I will see you in the next episode. Make sure you subscribe if you don't already. And yeah, see you next time.